Yo, what's going on? It's Malcolm back here with another update. Took a couple of days off because I felt generally the same through days 6, 5, 6, 7. Felt generally the same. Today I woke up and I felt like I've never had more mobility in my hands since the surgery. It feels almost, the pinky area and the ring finger area feels almost better than before surgery. Feels pretty decent right now. I cannot lie to you. My thumb is having a bit of stiffness issues, and I attribute that to the first dorsal wasting as well as the muscle in my thenar space. Right about here. Definitely feel a bit tender right here at the moment. I do think that's normal when it comes to muscle wasting, but it's just something to note. But generally, I feel my hand in general feels pretty good. Definitely have some pain along this outside region where that bone is that's popping out. Definitely got some pain right there, going up a little bit into the forearm. But also think that's just nerve getting used to being in a new spot. I can move my wrist up and down, doesn't hurt too bad. It's not the worst pain. It's when I go this way, right there, when I go to the inside, that is where I feel most of my pain. Discomfort, tightness, bit of stiffness. I'm hoping after I take the wrap off, my arm is under a little bit less pressure. I feel like every day the wrap is actually getting looser, just because of wear, but it is still tight in some areas, specifically around my elbow crease, and then around to the tip of my elbow, if I had to describe it. I'm hoping that when I remove the wrap from this part of my arm, when the surgeon does that, I feel instant relief of pressure. Definitely feel like my muscles are being squeezed a bit. When I open my hand, I feel it all the way up into my forearm and elbow. And it just feels like pressure and just tightness, you know what I mean? It's a dressing on it, so comes with recovery, I would have to assume. But other than that, doing okay. Not really too upset. Still feel like the surgery worked. Actually, right now, I'm laying on this pillow and my elbow's a bit numb. And I think it may be from having my arm, the incision site is exactly where my arm is laying at the bottom. So yeah, I feel like I can't really do much about that, but doing good. One thing I've been doing, I've been getting ready for PT, physio, or the fact that I may not get a recommendation. I don't know how it's gonna go. On the chance that I don't get a recommendation, though, I do have almost all of the supplies needed to get me back in shape already. The bands, the bands, the weights, only thing I don't have is some putty. I want to get some putty really bad, just to test grip strength and all this stuff, and then also a grip strength kit. I do want to test that as well. The little finger clickers and the tool you use to just squeeze and get your grip back. In the meantime, what I've been doing is either taking my pillows or some t-shirts, and I've been just squeezing them, put them back down, pick them up and squeeze them, and squeeze. I do believe in early PT. I do think PT is necessary when you have this type of injury. Your nerves are firing loud. Muscles have a potential to atrophy after the procedure is done, simply because you will be in a position where you cannot move or use your arm. There's no time to say when that can happen, but it can happen way faster than you think, within days, within weeks. It all depends on your body, and I do not want to get caught up in that mess. I'm already caught up in a mess. I don't want to get caught up in any more deeper messes. I'm around my hand, my forearm, my triceps. I feel like my biceps will be pretty safe, but the muscles in the areas I just described, I feel like those have the greatest potential to go bad on you. So yeah, that's kind of been something I've been doing. Still doing the pinching motions, opening my hand. I can actually make a pretty tight fist right now, trying not to do anything to cause discomfort. At a point, doing this, extending my hand or closing it, caused extreme discomfort, specifically around the incision site. I assume that's from my muscles moving and then stretching the cutout. If you scrape yourself or cut yourself and the skin begins to heal back together, if you move, you can cause the scab to separate. And people know what that's like. You know what that's like. It's a cause for more healing and a longer healing, just because you're essentially opening a wound that's trying to close itself. And so I've been conscious of that, but I've also been very conscious of the fact that I need to use my hand. So I hope I'm okay. When I go to the surgeon, see the bandage off and see what the incision site and scar looks like, I just hope that I'm okay, it's healing correctly, and I hope I'm not doing anything currently to make it a longer process than what it has to be. Today when I woke up, somebody was knocking on my door, and I jumped out of my bed. And what I did, I'm gonna show you real quick. With my arm that's currently wrapped, I jumped out of bed, and when I get out of bed, I lean to the right side, because the ledge of my bed to the rest of my room is on the right side. But anyways, I got up and I literally did this with my bad arm, and I felt such excruciating pain in the incision site. The first thing I thought of was my fascia sling breaking. I said that's my biggest fear with this whole thing, is needing to go back and get a revision here, because the fascial sling that they made, using the tissue and subcutaneous tissue on my arm, so afraid of it breaking, because before it had the chance to heal, become strong, granulate, whatever word you want to use, that's my biggest fear. And so I popped out of bed and immediately was regretting that decision. I was very upset for 15, 20, 30 minutes, honestly, and in pain as well. And all I could think of was, I don't want to wake up tomorrow, when I go to sleep tonight, with the symptoms that I had before, because I just did something super duper intense to break the sling. But I'm gonna be hopeful. I hope that didn't happen. It's just a fear that I have, and I hope that I'm still okay. I did have some twitching in my hand, on this hand, and this area right here, after it happened, and that was also scary. I was getting twitching in my hand before because my muscle was slowly wasting away, and so to my knowledge, that only happens because my muscle's wasting away. And I almost felt that I messed up, but I don't know. I have no idea. I'm not a doctor. I don't have an ultrasound machine, and I don't have x-ray vision. I can't see through my arm, so I really don't know. The doctor is gonna fill me up. No diddy. The doctor's gonna fill me up after taking my wrap off, and hopefully do a test to make sure that I don't have subluxation. That would mean that transposition was successful. It was already successful surgery, so the transposition was successful, but for long term, the transposition needs to be successful. And I need to be able to have that fascial sling stay intact in order to keep my nerve where it's at now. But yeah, like I said, I can open my hand with the least discomfort that I've had since the surgery. It feels, if I can compare day one, not really day one, if I can compare day one, I was pretty numb, I couldn't use my hand at all. But day 2 to day 8, night and day. When I would do this, my whole arm would feel discomfort, and today I don't even really feel pain in the incision site from doing this. And closing my fist. My fist hasn't been so tight since before the surgery. So, yeah, all in all, 10 out of 10 recommend. If you're dealing with this, please seek help. Seek treatment. Don't let this go for a long time. I know everybody has plans and things they need to get done and things they want to get done for themselves, but your health is so important. It's valuable. You are nothing without it. You could have everything in the world, but if you have your health, you won't be able to enjoy it. So yeah, that's about it. It's still a ride. I'm only 8 days in. Yeah, still thankful for my doctor. Can't wait to shake his hand and tell him thank you for helping me out, because I didn't see him after the surgery. Cut my facial hair off. It was getting kind of wild. I cut my own hair. I can't really give myself a full haircut right now, because I got one hand out of commission, and it happened to be my dominant hand, the one that I was most comfortable using the clippers with. I can still use my left hand, but going through your whole head's a little rough. Don't want to put myself through that. And yeah, just trying to push just every day, just trying to get through it. But I appreciate everybody's eyes and ears that I've been watching. Hope I'm helping somebody out. Hope I'm easing somebody's mind. The fear of my hand not coming back to 100% after surgery was heavily it was lessened by the fact that if I didn't get surgery anytime soon, my hand was only gonna get worse. And so really, I say, if you need this done, don't be afraid. Not saying it will always go well, but it's a better chance of it going well than not. So yeah, I don't know, it's just, I'm hurt. I'm just trying to get through it. I'm just recovering. Yeah. Y'all have a good rest of your day.